Hello, my name is Donald Hunter, and I did my presentation on type 2 diabetes. So what is type 2 diabetes? To understand that, first we're going to have to understand what insulin is. And it's basically a hormone made by your pancreas that enables your cells to take in sugar. So if your cells don't respond normally to insulin, then that means you have insulin resistance. In response to insulin resistance, your pancreas is going to make more insulin in an attempt to make your cells have sugar. And it's just going to keep doing that until it can't keep up with insulin demands. And that's when it's labeled as type 2 diabetes. So what are the symptoms of type 2 diabetes? So if you have diabetes, you might lose weight without trying, have blurry vision, have numb or tingling hands or feet, feel very tired, have very dry skin, or have sores that heal slowly. So these are all warning signs of diabetes. As a result of diabetes, you can get, or as a result of high blood sugar, you could get heart disease, vision loss, or kidney disease. All are very serious, and these two are fatal. So what population does type 2 diabetes affect? So here's some general facts about type 2 diabetes. So 37.3 million people have diabetes in the US, and 90 to 95% of those people have type 2. And 1 in 5 people with diabetes don't even know that they have diabetes. 96 million people over the age of 18 have prediabetes, which is like the stage in between being at a healthy blood sugar level and a diabetes level, blood sugar level. So here's diabetes distribution by age. So it's most common, or we'll start here. It's least common in ages 18 to 44 with 4.9 million cases. It's most common in ages 45 to 65 with 14.8 million cases, and second most common in ages 65 and over at 14.3 million cases. By race and sex, so it's going to be most common among American Indian and Alaskan Natives, and it's also divided by men and women, so it's more common in women, American Indians, and Alaskan Natives. And it's also most common in blacks or non-Hispanic blacks, and it's least common in white or non-Hispanic whites. So by education, diabetes is most common in the lesser educated. So if you have not completed high school, then you're more likely to have diabetes with a total percentage of 13.4%. And if you're in high school, or if you have a high school education, then you have a 9.2% chance of getting diabetes. And if you have a higher than high school education, it's 7.1%. Diabetes distribution by the federal poverty line. So if you're below the federal poverty line, then you have the highest risk of getting diabetes with a percent chance of 14.1. And the lowest chance of getting diabetes is if you're at 5 times the federal poverty line. So among men versus women, it kind of varies between which category we're looking at. So we have diagnosed diabetes, undiagnosed, and total diabetes. So men take the lead in diagnosed at 11.6%, and for undiagnosed, women are higher at 3.6%. And for total percent, it's men with 14.2%. So how do you know if you have type 2 diabetes? You could take a blood test. Your doctor will probably give you a blood test if you think you have diabetes. And the most common one is the A1C test, which will measure and average your blood sugar level over the course of 3 months. So to the right, we have the diagnosis according to the readings. So if your blood sugar level is 6.5 or above, 6.5% or above, then you have diabetes. If you're in this range, 5.7 to 6.4, then you have prediabetes. And if you're below 5.7, then you're at a normal, healthy level. And how can you prevent type 2 diabetes? The best prevention is weight loss. So the CDC says that losing even a small amount of weight, which is 5 to 7%, can dramatically lower your risk for developing type 2 diabetes. So if you're like around 220 pounds or so, then that can be like 10 pounds that you have to lose for you to return to like a healthy weight, regarding diabetes at least. So more tips by the CDC is to work with a trained coach to make realistic, lasting lifestyle changes. Diet better, so learning how to eat better and adding more physical activity to your day. Stress management is important. Stay motivated towards your goals and get support from people with similar goals. And here's my works cited. Thank you for your time and listening.